Hey everybody, hope everybody's doing well today. Just another little quick update. Yesterday was not my friend. I literally was debilitated by migraines. It's not quite as bad as they were yesterday, but I ended up having to take pain pills, and I'd hate to do that. I do not like to, believe it or not, but I also don't believe in suffering. And this is one thing I'm upset with Dr. Cox about, is that with no doubt, with stretching the skin, having, taking away skin, stretching, that obviously is uncomfortable, but this surgery would be nothing if it were not for these excruciating migraines. Don't get me wrong, I mean, it's tender and stuff, but I mean, and as much as I had skin and all other kind of stuff removed, you would think it would be a lot worse. I mean, like, they had to go in here and suture up under here and all that. And that is fine, other than the itching. It started to like itch like a mug. But it's that, yes, I've told them that I have migraine. And when I say I don't believe I've ever had migraines like this, not this severe and for this long. I've had them since the surgery, and they've only progressively gotten worse. I can no longer wear my glasses at all. The only reason I'm able to do this video right now is, believe it or not, it looks like it's brighter in here, but it's not. I'm laying up in the bed with my head cocked back. I'm on some pain medication, and my husband made me take a Klonopin for whatever reason, which I get because it does help. It can help with pain, but pain pills don't make me loopy, but Klonopin will certainly. But I mean, like last night, I broke down. It was, put it this way, it was so bad that my husband came back, left for work this morning, and came back and woke me up. He was so worried. And I promise y'all, I mean, I will complain. I don't believe in going through life and pretending crap is okay when it's not. I mean, you don't have to be a constant whiner. But I think if complain, especially when it's justified. And I've never, and I am a migraine sufferer, and this is beyond horrible, and I am angry. I'm very angry at Dr. Cox, because they should have something in plan for this. He should have known that the pain I'm feeling is not from the surgery itself. It is from what the surgery has caused, which are debilitating. When I say debilitating, then I can't do anything. I can no longer wear my glasses either, because I can't have any type of pressure on my head at all. I also think it's the nerve or whatever that's right here. But if you feel here, like, I can't stand it. It just makes me want. I had to take a what's it called? Why can I not think of the name of it? You put it under your tongue for nausea. They usually give it to cancer patients. I literally had the name of it last night, but anyway, last night, just so I could eat something. I don't feel like eating at all, like at all. I mean, y'all, my poor sweet husband, he, you know what he bought me yesterday? I mean, he's just trying to make anything and everything better. He bought me a laptop, um, and I can't even use it because I can't see it. Ooh, see how it. Um, and I mean, he's just trying to make anything better, and that's what I told him. I said, "Hun, just you being here and helping me and taking care of me." I said, "That's enough." I said, "I don't need stuff like that." He goes, "I know." He goes, "But I know you're wanting to do these videos, and and you're trying to, do it where everything looks nice." I said, "At this point, Ben, I don't care if it looks nice. I don't care if my intros look good. I don't care if I look good." I said, "It's more about the message than the appearance of me or the message." I'm praying one day that I get to come on here and actually look decent. Um, that day does not today, and it does not look like it's gonna be tomorrow. And um, let me see, it just comes on, y'all. I mean, it's not like it's not always hurting. Like I'm sitting here talking to y'all and it's hurting, but it's like all of a sudden, I mean, like I was in tears. I'm literally in the shower in tears last night. Like my husband's like, and I don't mean this to sound the way that it sounds, but it gets so bad that it will hurt so bad that I think if I went to sleep and didn't wake up, I would be okay with that. It hurts that bad. Not that I want to hurt myself, but that's how bad it hurts at times, that it's so excruciating. Um, and It's just I can't. And then the last couple of days, I've been having like these weird, funky ass dreams, and I mean, and they wake me up and they cause me anxiety, and it's just a and of course anxiety is not going to help with the tension that will also mess up with your migraines and things like that. I have to do this because this side's the worst. Like the light hits it, but and this just to me looks so weird, y'all. I mean, it's just tender right here on the edges. And if you touch it, like if I touched it right here, it would send such a shockwave through my head that it would cause such a migraine for hours. Um, so I've never had anything, I'm not hurting from the things like you would think, this big gas jagged scar where they had to put my lip back together and do all this up in here, because everything was gone, and you would think that would be painful. And it's a little, no, it's not really. I mean, I'd really have to push it. You can tell it's pretty swollen, and but it's not really hurting or anything. But it's the migraines. I thought to myself, why? And I don't mean to complain, but I don't care. I'm complaining. Why? Why can nothing be normal? I'm trying not to get upset because it will trigger a real bad migraine, but I mean, I don't understand it. Nothing, I mean, seriously, nothing can be normal. I'm not trying to be, don't pity me. Um, I just don't understand it. I expect it, I just don't understand it. So, sorry, I'm trying to get something to, you know, but and it's like somebody said, "This too shall pass." I'm like a 10-pound kidney stone, but sure, it'll pass. You know, I'm one of those people. I don't like fake optimism. You don't know what it's going to be like when it's over. You don't know what it could be worse after the next surgery. Do you see what I'm saying? So don't tell me. Just imagine in the future. I can't see in the future. I can see right now what's happening to me right now. Mm, and I am actually quite optimistic. Believe it or not, I'm an optimistic person. I'm not a negative person. I'm what you would call optimist realist. Um, you know, um, but enough has happened to me for me to know that it's not going to be normal. So, and and I can't stand for somebody to tell me that, just think down the road. It is all going to be worth it. No, you don't know that. Please don't say that to me. Don't say that to me. It angers me. It angers me for people to say that to me or to other people. Just tell me, I I myself don't know how it's going to be. I don't know what you're going through, and I don't know how it's going to be at the end. But I pray that it will be the best outcome that you will have, and that you can say it was worth it. I don't know if it will be, but not. I mean, I'm not stupid. I feel horrible. So don't come in here and tell me that pretty soon I'm going to have rainbows and unicorns shooting out my ass, because that would feel better. It's not going to happen, but it would feel better than my head and my migraines. So, I'm one of those people. I'm not a glass half empty, half full, or whatever. I'm just a realistic, and I don't like for somebody to just try to blow smoke up my ass. Just tell me you don't know what to say, that you just wish, the best for me, and at the best outcome, that you don't know. Nobody knows, but by all accounts, it most likely will be, but for now, just focus day by day, that kind of thing. I mean, because I can't see 5 minutes from now what's going to happen. I could be curled up in a ball crying, or I could be just as jolly as the day is long, which I kind of doubt that's going to happen, but I will be as sarcastic as the day is long. So, and I worry about my husband, and then I worry about my son. I don't like for them to see me like this, but I have to be able to feel, I have to be vulnerable. I have to have a place to be vulnerable. And finally, I told my husband, because he's so worried about me, and he gets so worried, it comes off, of course, he's military, it comes off angry, like it's how it sounds. It's not what it is, but